Assalamu alaikum warahmatullahi wabarakatuh. Hello Jonah Club listeners. Today I'll be talking about the cryotherapy, the new approach in managing pain, especially in cases that were diagnosed with symptomatic irreversible pulpitis in posterior teeth. When the inferior avenue nerve block fails, it's a randomized controlled trial by the Egyptian group led by Alheeny, published in June of last year, 2023. So the rationale behind this paper is the importance of pain control, which is a significant factor when the inferior avenue nerve block fails. As we know, it has a low success rate that ranges from 14 to 57, according to a reader Amnesty in 2018. Cryotherapy is a new approach that significantly improves the efficacy of inferior avenue nerve block other than other supplemental techniques. And in this paper, the cryotherapy used was the cold application of ice packs, which was well-known approach for post-operative pain management generally in the medicine, and the physiological effect of the cold compressor application derived from its ability to decrease the local inflammatory response and slow down the nerve impulses, spread and minimize the hemorrhage and post-operative edema. The use of the cold application after mandibular blocks was tested in only one previous study that reported significant enhancement of pulp anesthesia with a success rate of 55.8% compared to the standard inferior avenue nerve block without the cold compressors that succeeded in only 30.8%. So the aim of this paper is to first assess the effectiveness of cryotherapy application after inferior nerve block injection of the mandibular first permanent molars diagnosed with symptomatic irreversible pulpitis. It included 152 participants aged from 10 years to 17, and they included only mandibular first permanent molars, which were diagnosed with symptomatic irreversible pulpitis. The participants were randomly assigned into two equal groups. The first group received inferior avenue nerve block followed by a cryotherapy intervention group, and the second group only received conventional inferior avenue nerve block, which was the control group. For the intervention group, they used ice packs wrapped in sterile gauze that were applied to the buccal vestibule for 5 minutes. The effectiveness of the local anesthesia was checked after 20 minutes. Both subjective and objective indicators were identified. The subjective were numbness of the lower lip and tongue, and the objective was using the electrical pulse test at 2 intervals, 2 minutes apart, and a thermocold test with a cotton pellet. And the intraoperative pain intensity was measured using the VAS analog scale, presented from score 0, which was no pain, to 10, the worst pain, and the intensity was then subclassified into 4 levels: no pain as 0, mild pain from 1 to 3, moderate from 4 to 6, and severe from 7 to 10. And the pain assessment was performed before and during the access cavity preparation. The participant who experienced any pain during the access cavity preparation received a intraligamentary supplemental injection of 0.5 milliliter articaine. To the results, a significant reduction in the overall intraoperative scores were found in the cryotherapy group compared to the control group, with 59% to 40% favoring the cryotherapy group. And for the participant who recorded a preoperative moderate pain intensities, had significantly lower scores in the cryotherapy group. However, the participants who reported a severe intense preoperative pain had no significant differences in both groups. And the frequency that was needed for the extra supplementary intraligamentary injections was seen more in the control group, 67% compared to 50% for the intervention group. There are some limitations that could negatively impact the results of the study, which is the complex nature of the pain, having other factors that could affect the pain assessment, such as the preoperative anxiety and the different pain threshold, which would influence the subjective scoring system. However, we tried to overcome this by the proper randomization process, which ensured equal distribution of different determinants. So in conclusion, The application of cryotherapy demonstrated a notable enhancement in the efficacy of pulpal anesthesia, although additional anesthesia remained crucial to achieve optimal pain control in the severe preoperative pain requiring the interligamentory injections. The cryotherapy group was markedly lower compared to the control group. In my opinion, the suggested technique has a promising advantage in terms of reducing the necessity to use supplemental injections and techniques, and utilizing the positive impact of cryotherapy on pain management, especially in this young specific population of under age of 18, without the need to resort immediately to intraosseous method. Although it was proved to have a very high success rate, it is more invasive. And it is important to highlight that this technique needs a more further clinical trials to establish its efficacy.